12 warning signs of diverticulitis you should never ignore. Welcome to today's video. We're diving into an important topic that could literally save your life. The 12 warning signs of diverticulitis you should never ignore. Diverticulitis occurs when small pouches, called diverticula, form along the walls of your colon and become inflamed or infected. These pouches often start out harmless, but when inflammation strikes, things can escalate quickly, turning a mild digestive issue into a serious medical emergency. Understanding how this happens and recognizing the early signs can make all the difference. Left untreated, diverticulitis can lead to severe complications such as abscesses, bowel perforation, or even peritonitis. In this video, we'll break down each of the 12 key symptoms you need to watch for, explaining not just what they are, but why they occur and what they reveal about your digestive health. By the end, you'll have a clear picture of how to spot diverticulitis before it becomes dangerous and when it's time to seek medical help. So, let's get started with the 12 critical signs of diverticulitis that demand your attention. Disclaimer: the information we share is for educational purposes only and shouldn't replace professional medical advice. If you experience any of these symptoms, especially together, reach out to your healthcare provider right away. Early detection is the best defense against serious complications. All information presented has been thoroughly researched and verified. You can find source links in the video description. 1. Lower left abdominal pain. The most characteristic symptom of diverticulitis is sudden, severe pain in your lower abdomen, typically concentrated on the left side. This pain represents the hallmark feature that distinguishes diverticulitis from other digestive conditions. The location is significant because most diverticula in Western populations form in the sigmoid colon, which sits in the lower left quadrant of your abdomen. Patients consistently describe this pain as sharp, cramping, or knife-like in quality. The sensation begins when the diverticula become inflamed, causing the colon wall to stretch and irritate nearby nerve endings. This isn't a dull, vague discomfort. It's an acute, attention-grabbing pain that demands your focus. The pain pattern is equally important as the location. Many people notice the discomfort starts mild, but progressively intensifies over several hours or days. This escalation occurs as inflammation spreads through the colon tissue and potentially into surrounding structures. Some patients experience constant, unrelenting pain, while others describe waves of cramping that come and go. The pain often worsens with movement, coughing, or any activity that increases intra-abdominal pressure. Eating can also exacerbate the discomfort as food moves through the inflamed section of intestine. What makes this pain particularly concerning is its persistence and severity. Unlike gas pain or minor digestive upset that resolves quickly, diverticulitis pain continues and worsens. The inflammation causing this pain won't resolve on its own without medical treatment. If you develop sudden, severe lower left abdominal pain that lasts more than a few hours, this warrants immediate medical evaluation. Don't wait to see if it improves. Early diagnosis and treatment prevent complications like abscess formation or perforation. 2. Abdominal tenderness. Beyond just feeling pain spontaneously, your abdomen becomes extremely tender to touch when diverticulitis develops. This tenderness means even light pressure on your lower abdomen causes significant discomfort or sharp pain. Medical professionals call this point tenderness because pressing on the specific inflamed area triggers an intense pain response. The tenderness occurs because inflammation makes the colon wall and surrounding tissues hypersensitive. When you or a doctor presses on your abdomen, you're essentially compressing already inflamed tissue, which sends pain signals to your brain. The inflamed segment of colon cannot tolerate any additional pressure. Your abdomen may also feel unusually firm or hard when pressed. This firmness results from involuntary muscle guarding, where your abdominal muscles automatically contract to protect the inflamed area beneath. Think of it as your body's instinctive defense mechanism. The muscles tighten to create a protective shield over the injured tissue. In some cases, visible swelling accompanies the tenderness. Your lower abdomen might appear distended or protrude more than usual. This swelling combines intestinal inflammation with the muscle guarding response, creating a palpable mass or fullness that's detectable both visually and by touch. Healthcare providers assess tenderness systematically during physical examination. They gently press different areas of your abdomen, watching for your reaction and feeling for abnormal firmness. Severe tenderness localized to the lower left quadrant strongly suggests diverticulitis. The combination of spontaneous pain plus tenderness to touch creates a double confirmation of inflammation. When both symptoms present together, they paint a clear clinical picture that helps doctors diagnose diverticulitis quickly and initiate appropriate treatment before complications develop. 3. Fever and chills. Diverticulitis almost always triggers your body's infection-fighting response, manifesting as fever and chills. When bacteria from your intestine invade the inflamed diverticula, your immune system detects these invaders and raises your core body temperature. A fever of 100.4 degrees Fahrenheit, 38 degrees Celsius or higher is the medical threshold that indicates your body is actively fighting an infection. This elevated temperature isn't random. It's a deliberate immune strategy. Higher body temperatures help your white blood cells function more efficiently and make it harder for bacteria to reproduce. Your hypothalamus, the brain's temperature control center, resets your body's thermostat upward when it detects infection-fighting chemicals called pyrogens in your bloodstream. Chills frequently accompany the fever in diverticulitis. You might experience uncontrollable shivering or feel intensely cold even when wrapped in blankets. These chills occur during the fever's onset as your body works to reach the new, higher temperature set point. The shivering generates heat through rapid muscle contractions. Your body literally shivers to warm itself up to the elevated temperature your immune system has demanded. Once your body temperature reaches the new set point, the chills typically subside, though you may continue feeling alternately hot and cold. The presence of fever indicates that diverticulitis has progressed beyond simple inflammation to actual infection. This infection could be contained within the colon wall or might have spread to form an abscess in the surrounding tissue. Either scenario requires antibiotic treatment. A high fever above 102 degrees Fahrenheit, 38.9 degrees Celsius, or a fever that continues rising despite medication suggests severe infection. This pattern may indicate abscess formation or even early peritonitis, both serious complications requiring immediate medical intervention and possibly hospitalization. 4. Nausea. Feeling nauseated represents one of the earliest warning signs that something is wrong with your digestive system during a diverticulitis attack. This queasy, unsettled sensation in your stomach occurs as your gastrointestinal tract responds to inflammation and infection. The nausea isn't just in your imagination. It's a real physiological response to the inflammatory process happening in your colon. When your colon becomes inflamed, it releases chemical messengers called inflammatory mediators. These substances travel through your bloodstream and stimulate the chemoreceptor trigger zone in your brain, a specialized area that detects toxins and triggers nausea. Your body essentially perceives the infection as a toxin that needs to be eliminated. The inflammation also disrupts normal gut motility, meaning your intestines don't contract and move food along as they should. This disruption causes a traffic jam in your digestive system. Food and digestive juices back up, creating that sick, queasy feeling in your stomach. Many patients describe losing their appetite completely during the early stages of diverticulitis. The thought of eating becomes unappealing or even repulsive. This appetite loss is your body's protective mechanism. It temporarily shuts down hunger signals to give your digestive system a chance to heal. The nausea may come in waves, intensifying when you move or when pain increases. Some people find that certain smells or even the sight of food triggers or worsens their nausea. This heightened sensitivity reflects the connection between your inflamed intestine and the nausea centers in your brain. While nausea alone doesn't confirm diverticulitis, when combined with lower abdominal pain and fever, it forms part of the classic symptom triad. Don't dismiss persistent nausea as simple indigestion. It may be signaling serious intestinal inflammation. 5. Vomiting. Vomiting represents an escalation from simple nausea and indicates more severe inflammation or complications developing. When the nausea intensifies to the point of actual vomiting, your body is responding to overwhelming signals from your inflamed digestive tract. This symptom progression from nausea to vomiting often correlates with worsening inflammation or increased infection severity. The vomiting reflex activates when your brain's vomiting center receives too many distress signals from your gut. The accumulated inflammatory mediators, combined with pain signals and disrupted motility, overwhelm your system's ability to maintain normal function. Your body essentially decides that emptying the stomach might relieve some of the digestive burden. In diverticulitis, vomiting may also signal developing complications like intestinal obstruction. If the inflammation causes enough swelling, it can narrow or partially block the colon passage. When intestinal contents can't move forward normally, they may reverse direction, triggering vomiting. The characteristics of the vomiting matter. If you're vomiting undigested food shortly after eating, it suggests the stomach is emptying upward because contents can't proceed downward. If you vomit bile, a yellow-green bitter fluid, it indicates your small intestine is also involved in the backward flow. Persistent vomiting creates additional problems beyond the underlying diverticulitis. You lose fluids and electrolytes with each episode, leading to dehydration. Signs include decreased urine output, dry mouth, dizziness, and increased weakness. Dehydration compounds the stress on your already compromised system. Repeated vomiting also prevents you from taking oral antibiotics or maintaining adequate nutrition. This interference with treatment makes hospitalization more likely. If you vomit more than twice in the context of abdominal pain and fever, you need immediate medical evaluation and possibly intravenous fluids. 6. Constipation. Constipation during diverticulitis occurs when inflammation slows down your intestinal motility, the rhythmic contractions that normally move waste through your colon. The inflamed segment of bowel becomes sluggish and doesn't contract efficiently, creating a bottleneck in your digestive system. Stool accumulates behind this slow-moving section, becoming progressively harder and more difficult to pass. The inflammatory process directly affects the smooth muscle in your colon wall. These muscles normally contract in coordinated waves called peristalsis, pushing intestinal contents forward. When inflammation disrupts this coordination, the affected segment may contract weakly or not at all, causing intestinal contents to stagnate. Pain also contributes to constipation in diverticulitis. The discomfort makes patients reluctant to strain or bear down during bowel movements because these actions increase abdominal pressure and worsen pain. This reluctance creates a cycle. Avoiding bowel movements leads to harder stools, which become even more difficult and painful to pass. You might experience a frustrating sensation of incomplete evacuation. Even after a bowel movement, you feel as though you haven't fully emptied your bowels. This feeling occurs because stool remains trapped above the inflamed, constricted section of colon. The stools themselves often become hard, dry, and pellet-like. This hardness develops because the prolonged transit time allows your colon to absorb more water from the stool than usual. Less water content means harder, more compact feces that require more effort to expel. Some patients strain excessively trying to move their bowels, which can be dangerous with diverticulitis. Straining increases pressure within the colon, potentially causing an inflamed diverticulum to rupture or perforate. If you're experiencing constipation with abdominal pain, seek medical help rather than straining or using aggressive laxatives. 7. Diarrhea. Paradoxically, some people develop diarrhea rather than constipation when diverticulitis strikes. This opposite response occurs because the inflamed colon attempts to clear the infection by speeding up transit time and increasing fluid secretion. Your intestine essentially goes into overdrive mode, trying to flush out the bacteria causing the problem. The inflammation triggers your colon to secrete more water and mucus into the intestinal contents. This secretion serves a protective function. The extra fluid dilutes bacteria and toxins while the mucus coats and protects the damaged intestinal lining. However, these protective secretions also make your stool loose and watery. Some patients experience what's called overflow diarrhea. This occurs when liquid stool from above finds pathways around a partial obstruction caused by inflammation. You might pass frequent, small amounts of loose stool, even though you're also partially constipated, a confusing situation that results from the complex nature of intestinal inflammation. The diarrhea in diverticulitis often comes with urgency, a sudden, intense need to reach a bathroom immediately. This urgency happens because the inflamed, hypersensitive colon overreacts to the presence of stool. Normal stretch receptors that sense when the colon is full become hyperactive, sending exaggerated signals that create an overwhelming urge. You might notice mucus or small amounts of pus mixed with loose stools. These additions reflect the inflammatory process. Mucus production increases as a protective measure, while pus indicates that white blood cells are actively fighting infection in the colon tissue. Any sudden change in bowel habits, whether toward constipation or diarrhea, combined with abdominal pain and fever suggests diverticulitis. The specific change matters less than the fact that your normal pattern has shifted dramatically and accompanied concerning symptoms. 8. Bloating, abdominal distension. Bloating during diverticulitis creates an uncomfortable sensation of fullness and visible swelling in your abdomen. This distension results from multiple factors working simultaneously. Trapped gas, intestinal inflammation, and fluid accumulation all contribute to that tight, stretched feeling. The bloating often becomes severe enough that your clothing feels uncomfortably tight around your waist. Inflammation disrupts the normal movement of gas through your intestines. Your colon typically moves gas along efficiently through peristaltic contractions, but these contractions become uncoordinated when diverticulitis develops. Gas accumulates in pockets above and around the inflamed segment, unable to move forward normally. The inflamed colon tissue itself swells as fluid accumulates in the intestinal wall. This process, called edema, occurs when inflammatory mediators make blood vessels leaky, allowing fluid to seep from capillaries into surrounding tissue. The swollen intestinal wall takes up more space inside your abdomen, contributing to the bloated feeling. Your intestinal bacteria also produce excess gas during diverticulitis. The infection and inflammation alter the intestinal environment, affecting the balance of bacterial species. Some bacteria proliferate and produce more gas as byproducts of their metabolism, adding to the bloating. Many patients describe their abdomen as feeling taut, like an overfilled balloon ready to burst. Pressure builds because the gas and fluid have nowhere to escape. Forward movement is impaired by inflammation, and your body can't absorb or eliminate the excess fast enough. The visible distension can be dramatic. You might notice your abdomen looks noticeably larger or protrudes more than usual, particularly in the lower regions. This visible swelling combined with tenderness and pain forms an important diagnostic picture that helps physicians recognize diverticulitis quickly. 9. Rectal bleeding, blood and stool. Rectal bleeding or blood in your stool represents a potentially serious complication of diverticulitis that requires immediate medical attention. The blood typically appears bright red, indicating it comes from the lower digestive tract rather than the stomach or upper intestines. This fresh blood might appear on toilet paper after wiping, streak the surface of your stool, or color toilet water pink or red. The bleeding occurs when blood vessels in or near an inflamed diverticulum become damaged and rupture. Inflammation weakens blood vessel walls, making them fragile and prone to breaking. Sometimes the infection erodes directly through a vessel wall, creating a direct pathway for blood to enter the intestinal space. The amount of bleeding varies considerably. Some patients notice only slight spotting or a few drops of blood, while others experience more substantial bleeding that colors the entire bowel movement. Even small amounts of blood shouldn't be dismissed. Any visible blood with diverticulitis symptoms warrants professional evaluation. Blood mixed throughout the stool versus blood only on the surface provides diagnostic clues. Surface blood suggests bleeding from lower areas like the rectum or anus, possibly from straining. Blood mixed throughout indicates bleeding higher up in the colon where the diverticula are located. Some patients experience painless bleeding, which seems counterintuitive given the painful inflammation. This painless bleeding can occur when a blood vessel in a diverticulum ruptures without significant surrounding inflammation. However, in acute diverticulitis, bleeding usually accompanies the characteristic pain and tenderness. The combination of bleeding with fever and abdominal pain creates particular concern. This triad suggests active inflammation with vascular involvement, increasing the risk of significant complications. Any rectal bleeding in the context of diverticulitis symptoms requires prompt medical assessment to determine if hospitalization or urgent intervention is needed. 10. Urinary symptoms. Urinary symptoms during diverticulitis might seem unrelated to intestinal inflammation, but the proximity of your colon to your bladder explains this connection. When severe diverticulitis develops, the inflammation can extend beyond the colon wall to irritate adjacent structures. The sigmoid colon sits very close to the bladder, separated by only a thin layer of tissue in the lower abdomen. You might experience urinary frequency, needing to urinate more often than usual, sometimes just passing small amounts. This frequency occurs because the inflamed colon tissue irritates the bladder wall, making it hypersensitive. Your bladder feels full even when it contains minimal urine, triggering frequent urination urges. Urgency often accompanies frequency. You develop sudden, intense needs to urinate that feel impossible to delay. The irritated bladder contracts prematurely, creating that desperate rush to the bathroom sensation. This urgency can be embarrassing and disruptive to daily activities. Pain or burning during urination, called dysuria, suggests the inflammation is significantly affecting the urinary tract. The irritation causes the urethra and bladder to become inflamed, making urination uncomfortable. Some patients describe a stinging or burning sensation when urine passes through. In severe cases, a fistula can form between the colon and bladder. A fistula is an abnormal connection or tunnel that develops when infection erodes through the tissues separating these organs. If this occurs, you might notice air bubbles in your urine, called pneumaturia, which appears as frothy or fizzy urine. Passing stool in your urine or experiencing recurrent urinary tract infections without clear cause also suggests a colovesical fistula. These signs indicate a serious complication requiring surgical intervention. Any urinary symptoms accompanying diverticulitis pain should prompt immediate medical evaluation to check for this potentially dangerous complication. 11. Rigid abdomen, peritonitis. A rigid, board-like abdomen represents one of the most dangerous signs of diverticulitis and constitutes a surgical emergency. This rigidity, called peritonitis, occurs when infection spreads from the colon into the peritoneal cavity, the space surrounding your abdominal organs. When you or a doctor presses on your abdomen, it feels hard as a board rather than having normal give and softness. Peritonitis develops when an inflamed diverticulum perforates, meaning it ruptures completely through the colon wall. Intestinal contents, including bacteria and digestive fluids, spill into the normally sterile peritoneal cavity. Your body responds with massive inflammation, and the abdominal muscles contract intensely and involuntarily in an extreme protective response. This involuntary muscle contraction, called guarding, becomes so severe that you cannot relax your abdominal muscles even if you try. The muscles remain locked in contraction, creating that rigid, wooden feeling. This rigidity differs from the firmness described earlier. It's an unmistakable, dramatic hardness that feels abnormal. Rebound tenderness often accompanies rigidity. This means pain intensifies when pressure is suddenly released from your abdomen rather than when pressure is applied. A doctor presses down on your abdomen, then quickly releases. If the pain worsens dramatically upon release, it indicates peritoneal inflammation. Patients with peritonitis typically lie very still because any movement causes excruciating pain. Walking, coughing, or even breathing deeply intensifies the discomfort. You might instinctively draw your knees toward your chest to minimize abdominal stretching. The presence of a rigid abdomen means immediate emergency department evaluation and likely urgent surgery. Peritonitis progresses rapidly and can lead to septic shock and death if not treated promptly. 12. Pallor or weakness. Unusual paleness of your skin, called pallor, combined with profound weakness represents a serious complication of diverticulitis that suggests significant blood loss. When bleeding from an inflamed diverticulum becomes substantial or continues over time, you develop anemia, a condition where your blood lacks enough healthy red blood cells to carry adequate oxygen to your tissues. Pallor becomes most noticeable in areas where blood vessels lie close to the skin surface. Your lips, gums, nail beds, and the inner lining of your lower eyelids appear paler than normal, sometimes almost white. This paleness develops because less oxygenated blood flows through these visible vessels. The weakness associated with anemia feels profound and overwhelming. Simple activities that normally require little effort, climbing stairs, carrying groceries, or even standing from a sitting position, leave you exhausted and breathless. Your muscles don't receive adequate oxygen to function efficiently, so they fatigue quickly. Dizziness frequently accompanies the weakness, especially when you stand up suddenly. This orthostatic dizziness occurs because your body struggles to maintain adequate blood flow to your brain when you change positions. You might experience lightheadedness, feel like you might faint, or have momentary vision changes like seeing spots or tunnel vision. Other signs of significant blood loss include rapid heartbeat, even at rest, as your heart tries to compensate by pumping faster to circulate the remaining blood more quickly. You might notice your heart pounding or feel it racing in your chest. Shortness of breath with minimal exertion also indicates inadequate oxygen carrying capacity. This combination of symptoms, pallor, weakness, dizziness, and rapid heartbeat, in the context of diverticulitis, suggests you're losing blood faster than your body can replace it. This situation requires immediate medical attention, possibly including blood transfusions, urgent endoscopy, or imaging to locate the bleeding source, and interventions to stop the hemorrhage. Subscribe to the Human Health YouTube channel for more insights. If you found this content helpful, please like, share, and comment below.